Obamacare, repeal and replace, Medicare, Medicaid, enrollment windows, pre-existing conditions, copays, HMOs, HSAs, PPOs. Healthcare is a stressful, confusing mess.
What if it was all as easy as this?
Turns out it can be. 16 years ago, subscription healthcare pioneer Dr. Brian Forrest was inspired to simplify his medical practice by fitness clubs.
My concept was that at a gym, you charge people a monthly fee and you use it as much as you need to.
Simple, right? Now think how different a trip to the gym would look if they got paid like most doctors' offices.
Every time you lift a curl, do a dumbbell, or walk on a treadmill, they don't follow you around with a clipboard and write down a new code for that. Yet that's sort of the insanity that we have in primary care.
The subscription healthcare model is gaining traction, with memberships ranging from as low as $20 a month for kids to between $50 and $100 a month for adults.
It's probably nationally around $70 a month.
There are different levels. In Dr. Forrest's practice, the basic plan covers, for instance, office visits, urgent care during office hours, and EKGs. But for vascular studies and pre-surgical testing, you'll need the premium plan.
So, let's talk about how the subscription model will change your trip to the doctor. For starters, expect less wait time.
The traditional fee-for-service model, the only way to make money is volume, volume, volume.
Subscription practices take on fewer patients, so forget crowded waiting rooms and scratch the old 550 rule, waiting 50 minutes to see the doctor for 5 minutes.
Now they wait for less than 5 minutes and they can spend at least 50 minutes with the physician.
And once you're with the doctor, you can expect more face time.
There's a reason doctors have their noses in a computer during your visit.
Because they have to be coding constantly and making sure they get paid.
Doctors don't need to code for reimbursement when their revenue stream comes from monthly membership fees.
My computer never goes into the exam room.
You're feeling okay today?
I am.
Which is a high-touch area, not a high-tech area.
Finally, and this depends on your current insurance plan, but subscription healthcare just might save you money because you're dealing directly with a local private practice.
They're not a big box store and they don't have to do all those markups. They essentially give the patient the medicines and the supplies at cost.
And once you pay just for the service, you'll be shocked at what you've been paying for billing and overhead.
An MRI that normally would cost $2,000, we might be able to get for a patient for around $250.
Ditching the insurance reimbursements and relying on monthly membership fees for revenue flips the entire healthcare equation.
We're not incentivized to make them come into the office more. In fact, we're incentivized in this model to keep them as healthy as we can. We've already gotten paid.
We have a link to help you find direct primary care physicians in your area on our website, thelisttv.com. A subscription to health is at the top of the list. So how'd I do?
You didn't do more of anything.